Hello, and welcome to Global Data Themes Instant Insights. At Global Data, we define a theme as something that keeps a CEO awake at night, as businesses that invest in important themes will succeed, and those that don't will fail.
Hello, and welcome to Instant Insights. I'm Emma Taylor, and today I'll be talking to thematic analyst Shabnam Perez and volunteer healthcare content creator Kaleb Ells, following the news that the NHS is now using virtual wards. Thank you both so much for joining me today. We'll start with you, Kaleb. What exactly are virtual wards, and how new are they?
Well, virtual wards are a way of monitoring patients after they've had procedures and after they've been discharged, and sometimes even to avoid patients ever having to come into hospital in the first place. And it's done remotely often using things like cameras or blood pressure monitors or heart sensors. So a lot of the equipment is very similar to that which you'd find in hospitals, but it's often Wi-Fi linked, and it'll send that data back to a clinical environment so patients can remain in their own homes without having to stay in or go to hospital in the first place. So this has been particularly used so far in supporting people who are frail, often elderly people, or quite often people with acute respiratory problems, and it just helps to reduce, or it can help to reduce, burden on the healthcare system and the amount of spaces filled up on hospital wards.
Wow. Whilst, on the face of it, that sounds amazing. Is this sort of like a particularly new phenomenon?
No. So while this might sound like a new phenomenon, virtual wards have actually been used by the NHS for 10 years. It's just following NHS strain, uptake has since increased. As of last year, 100,000 patients were actually treated within virtual wards.
Oh, wow. And so what are the actual advantages, like the detailed advantages of virtual wards?
Well, some of the advantages are things like it allows patients the chance to recover in the comfort of their own homes without having to remain in hospital, which can be sort of both disconcerting, but is also really quite strongly correlated. Long stays in hospital are really strongly correlated with further patient deterioration, through things like exposure to MRSA or other pathogens are found in hospitals, but it also gives patients the chance to return to an environment where you've got a support network around you, both family and friends in terms of emotional support, but also in terms of things like, particularly for older patients, that opportunities for conversation and interaction, which can help to prevent mental deterioration and you can sort of stave off or slow down the onset of things like dementia. They're really useful as well for reducing patients' average hospital stay, readmission rates, and A&E attendance, which presents quite a significant advantage to the NHS, which is already under huge strain, by increasing bed space and reducing the sort of burden on healthcare staff.
Yeah, of course. I mean, reducing that strain on the NHS is obviously such a high priority at the moment. Why are these not sort of implemented everywhere? What are the drawbacks, the dangers of these virtual wards?
So while virtual wards may have a plethora of benefits, there's also several drawbacks associated to them. So, it's absolutely crucial that staff are trained on how to use the new digital technology. For example, how to use, an ECG device that previously was not a remote device. So, virtual wards can also mean that doctors do miss out on physical cues of deteriorating physical health. Sometimes something as simple as a patient who would usually say hello has just, stopped. It could even be, the discoloration of fingertips. It could be really and truly even discoloration of skin. There are physical cues that are being missed out here in virtual wards. Not to mention, connected remote wearables require internet access with a secure and strong connection. And that's not always the case for everyone. I mean, I work from home and I know that's surely not the case for me. Patients who have issues with wearable devices may foresee longer response times as well, compared to patients within a clinical setting. Say if a wearable device was to fall off in the shower, or the tape of a wearable device started wearing away, it would take longer to have that resolved as opposed to being in a clinical setting.
Yeah, definitely. You can really see how accessibility, to technology could affect it massively. What do you think of the future of virtual wards will be, perhaps as we get more access to technological advancements?
Well, I think they're sort of bound to inevitably expand, partly because those additional technological advancements make it possible for them to expand, but also as there's growing pressure on healthcare services with a growing and an aging population, some of those more sort of cost-effective alternatives to care are going to be sort of increasingly necessary, or at least sort of wanted by healthcare institutions. But I think what's really quite important is that although that expansion seems very likely, it should really be done in partnership with both clinicians and patients to make sure that these virtual wards, as they come to take the place of more and more in hospital treatment and care, that they are both safe and effective, rather than prioritising cost over care, but also ensuring that there's the patient confidence in that care, because otherwise, if it's not clinically efficacious, there's clearly a huge problem there. But if patients and members of the public don't have faith in that process, that could prove a real challenge for uptake and cooperation with healthcare systems. So I think really getting that patient and clinical faith is one of the biggest challenges in the expansion of virtual wards. But if that can be done, if it can be proved both through data research and development of safety, but also in terms of communicating to patients what those benefits might be, then virtual wards could be a really powerful tool for future healthcare.
Yeah, definitely. I think including what you said, including the patient within the development of the technology will be key. Amazing. Well, thank you so much, Kaleb and Shabnam, for those instant insights. I think that's all we have time for. But thanks for listening, and from us in Thematic Intelligence, see you next time.